Hey there, Dr. Norris Goldberg, and I'm the owner of Koru Chiropractic Corrective Care in Louisville, Colorado. And today I want to talk to you about migraines. So migraines are a complicated issue. Everyone experiences them for different ways. They have different triggers. They experience different symptoms. But really what we believe, although we don't completely understand the cause of the migraines, we believe there's three common causes, right? There's blood flow issues, and this is what can cause some of that throbbing or pounding feeling in one side of the head, or even ocular vision disturbances. There's hormonal or chemical imbalances in the brain itself, so different than hormonal triggers. And then there's also potential tension or pressure on the brainstem and the trigeminal nerves, all right? So as an upper cervical specialist, this is something that I help people with on a daily basis. In fact, I have a really good success rate with migraines, even ones that for a lot of people have been told that they're simply not going to get better. They're genetic, hereditary, or that they're going to have to take medications for the rest of their lives. And, fortunately, there's a lot of people out in the world who just aren't happy with that answer, and they come and seek my care, okay? So although some people, maybe potentially don't respond, or we don't completely eliminate the migraines, we almost always see a reduction in the migraines. And in many, many cases, we get a complete elimination or almost like hibernation of migraines. They just completely go away. So the reason is, and it's actually explained in this poster behind me here, but because you can't see the text, I'm going to explain it to you. Three things. So I'm going to talk about the vascular component. We have 4 arteries that go into our brain, 2 vertebral arteries and 2 carotid arteries. Now they all come off the heart. The vertebral artery, though, runs through the spine just where this little elastic is here. It then enters through the base of the skull and supplies the base of the cerebellum right here and the brainstem as well. So really important parts for regulating really your whole body, your autonomic nervous system, okay? Also affects things like balance and coordination and movement, all right? This is why sometimes even just a vascular issue, you'll feel that throbbing in the back of your head. You can also feel like a really stiffening of the neck, also related, okay? Now, when you get a misalignment at the very top of your spine, the twisting action here, what happens is it actually almost pinches or occludes the artery. So you get a little bit less blood flow on that side, and that's going to cause a little, almost like a cramp in your brain. Just like you'd get a cramp in your muscle, it's going to spasm down, it's going to be painful. Well, if you're not getting enough blood flow to certain parts of your brain, you're going to start getting pain signals, okay? The second thing is how it affects the chemical balance in your brain. So your brain is very sensitive to chemical balances. That's affected by what we call the cerebral spinal fluid, which is essentially filtered blood, okay? This fluid is responsible for protecting the brain, right? Things like concussions, we've all seen those videos where the fluid, stops the impact of the brain against the skull wall, or unless if you go hit your head really hard, it won't stop it, and that's how we get a concussion. This chemical imbalance, so the CSF, is also responsible for getting nutrients and oxygen into the neurons and getting waste and CO2 out of the neurons and back into the blood, okay? So the problem is this CSF, it flows all around your brain and it goes all the way down your spinal cord and back up into the brain again. And it actually has a pumping mechanism to keep the fluid moving, similar to like a pond or a swamp. You wouldn't want stagnant water, right? Because then you're going to get bacteria, all kinds of nastiness in there. Your CSF, you want it flowing. You want to keep it nice and fluid and clean. That's how it gets filtered, okay? This filtration happens within the skull, within the brain, but this flow, again, happens around the spinal cord right here. And when you get a big misalignment in your spine, you actually will get a compression of certain parts of that flow, right? And so what happens is you get stagnation or high areas of pressure or low areas of pressure, and this can cause chemical imbalances, okay? So that's something, again, your brain's very sensitive to this, so you could be getting pain reception or pain points in your head from chemical imbalance. Now, the third thing that I see is that when you get a misalignment in your spine, what happens is this spinal cord actually attaches to the top 2 vertebrae of your spine, your skull, your occiput, your atlas, and your C2. So when you get twisting at the top, it actually will put tension or torsion through the spinal cord right at the level at C1, which is actually where your spine is connecting to your brain. This is called your brainstem. Tension on this part of your brainstem actually affects where the trigeminal nerve starts and then goes back up into the head. And that's why a lot of people who suffer from migraines will experience things like facial sensitivity and facial pain or numbness, okay? So I haven't covered, all the symptoms or conditions that can go on migraines. Obviously, like I said, it's a pretty complex issue. I just wanted to talk about some of the basics. And actually, now, how can I help you with this? Some people can work on alignment and posture and increasing blood flow into the brain simply on their own. And they can do special exercises, just work on their actual posture itself. And if that works for you, I'm all about it. So actually, I will give you free videos. It's on my YouTube channel. We call it spinal hygiene because I actually recommend doing these exercises on a daily basis because that's what really helps keep your spine healthy, strong, and vibrant, right? Just like a young, strong, healthy muscle. But if you don't use it, you lose it, right? And that's the same with the motion and the health in our spine. We got to maintain that motion and that flexibility, right? Now, the reality is, a lot of cases, though, is that you've had an accident or a trauma that's caused a misalignment at the top of the spine that you're not going to be able to fix with just doing exercise alone. And what I can do for you is I take an advanced set of x-rays to determine what degree that's been misaligned and what angles it's become misaligned at. And then with a very gentle and specific adjustment, we can realign that spine, taking the pressure off the nerves, off the blood vessels, and increasing the CSF flow so that your whole body, all three aspects of it, are functioning better. So it almost doesn't even matter which one of them is causing your migraines. We know we're going to improve all three. And that's why we see such great results right across the board in most of our migraine patients. So if you're suffering with migraines, I encourage you to check out some of my other videos on migraines. Read through our website. If you're close by, I encourage you to come check us out. We can do an evaluation, see if you'd be a good candidate for the type of care I do in my office. And if you're not, drop a line in the comments, and I'd love to help find a good upper cervical chiropractor near you.